Good morning. I am Senator Shelley Mayer. Pleasure to welcome you all this morning. I am here as a stand-in for my colleague, our colleague, Senator David Carlucci, who is doing the right thing and taking his father in for some medical tests. I hope he will be joining us shortly. And it's my pleasure and my honor to stand in for him today to host at the beginning, before he gets back, this very important webinar on the impact of COVID-19 on OPWDD and the people they serve, our constituents in New York. I'm very honored to be joined by several of my colleagues, and I know more will be joining us. Senator Todd Kaminsky, Senator Roxanne Persaud. Thank you for being here today. And thank you to the panelists who are going to be joining us for much of the day. Over the past weeks, all of us have heard from our constituents about the disproportionate impact of the COVID-19 pandemic on the groups served by the OPWDD agency in New York, our providers and our families, and the individuals with developmental disabilities themselves. We've heard from them, and their voices have to be heard out loud. Today, we look forward to hearing their testimony, asking them questions. There'll be a number of advocates, service providers, and coordinated care organizations, as well as individual family members who are going to speak up about the challenges that this COVID pandemic has presented to them and their loved ones. This forum will be used as an information gathering session for all of us gathered here today. Senator Carlucci is the chair of the Committee of Mental Health and Developmental Disabilities, which has jurisdiction over this issue. But all of us on this presentation care deeply about this issue and intend to continue to make the drumbeat heard about the needs of these members of our community. We believe the testimony today will inform our actions moving forward as we work to ensure that individuals with developmental disabilities are served through this pandemic and beyond. So I believe that I've noted the two of my colleagues who have joined so far, and as others join, I certainly will acknowledge them. They will have an opportunity to ask questions. We have 4 panels today made up of individuals from the different sectors I described. Each presenter will have 3 minutes to speak. At the end of each panel, senators will have an opportunity to ask questions of the panelists. So our first panel is 4 individuals. I'll introduce them briefly, and then they can speak each for 3 minutes. Susan Constantino, the president and CEO of CP Unlimited. Rhonda Frederick, president and CEO of People Inc. Al Kaplan, the senior policy advisor of AHRC NYC. Yvette Watts, the executive director of the New York Association of Emerging and Multicultural Providers, Inc. Ron Calavito, CEO of Supports for Living. So will the first panel join us? And we're going to go in the order of the program. So Susan Constantino, if you could unmute, and we look forward to hearing from you. Before I start, I'm sorry, I'm going to go backwards for a minute. We've been joined by Senator Simcha Felder. Do any one of my Senate colleagues want to say something briefly as we begin? Senator Kaminsky, Senator Persaud, Senator Felder, or should we just start? Okay, we will begin. Hello, former Assemblyman Weisenberg. Always a pleasure to see you.
My pleasure.
So we will begin then with Susan Constantino. Susan.
Thank you very much, Senator, and thank you for having us here today. I am, as the Senator said, Susan Constantino, representing both Cerebral Palsy Associations of New York State, as well as CP Unlimited, which is a large service provider in New York City. And I've been asked to speak first about the downstate area and when COVID-19 hit us and the responses. I'd like to talk first about the very first thing that we had to do, which was to have all of our providers designated as essential workers. Sounds easy, it wasn't all that simple, but it was critically important that our staff be able to travel, particularly in the downstate area where we were being asked to quarantine and to not travel. It was very important that we have all of our staff out and able to take public transportation and to get to where they needed to be. So our first piece was to again become essential workers. We had asked OPWDD perhaps 2 weeks before March 16th if we could look at closing day program. From what we knew, and it was very little at the time, but from what we knew, we were looking at a virus that traveled quickly. And because of the nature of the folks that we support, our day programs, it's very difficult to keep people separated. I'm not even sure at that time if we were being told to wear masks. We just knew that was a place where people were together and congregating. It took 2 weeks for that decision to be made, and unfortunately, it was probably too late. We already, at the time that they closed, had discovered or had tested some folks who were ill and who already had been infected with the virus. That meant, of course, that would then go back to our homes. The next very major obstacle that we faced was PPE. When we started this journey, I didn't even know what PPE stood for, but we've all soon learned that it's become part of our vernacular, our personal protective equipment. We just did not have it. We did not have what we needed. We did not have the supplies of gloves or masks or gowns. And we were asking our staff to go into homes and to work with and be with our people when they did not have the right protection. We were told that we should go to the Office of Emergency Management in our counties, that's where we would find it. When we went to the Office of Emergency Management in New York City, we were told that we weren't even on a list. They didn't know us. We weren't on a priority list, and we were not considered an agency, and I don't mean just my agency, as a field, we were not considered, at least in the downstate area, a group that they would be giving the equipment to. So we next had to fight to get ourselves listed after nursing homes as being a priority so that we could, in fact, receive the personal equipment, PPE, excuse me. However, we never really did receive any of that until much later, probably around May or June. We were able to, through our provider associations, get the PPE through all channels, as everyone did in this state, through China, through wherever, and spent a huge amount of money on doing that. We next had to look at how to isolate our folks. We were told that isolation was obviously critically important, but we were in small apartments in New York City where people shared bedrooms, and trying to find ways to isolate become incredibly difficult. Through our own devices, the agencies in their day programs that were now closed set up small little isolation units, but we did not receive the support that we needed in order to be able to be sure that we could do this. This was truly the problem. We were doing it based on what we knew. Yes.
Susan, I'm sorry, your time is running out. I think there are going to be a lot of questions. So,
okay.
Can you end then there?
I certainly can. I will just say that our staff were amazing and were there, and we had to pay a lot of extra money for them to make them know how much we appreciated them, but staffing was critical.
Thank you so much. And I know we've been joined by Senator John Liu. Senator Monica Martinez is having trouble getting in, but I believe she can hear us, and we will fix it so that she is here in person in a minute. I hope so. Thank you, Susan. Next, we will go to Rhonda Frederick, President and CEO of People Inc.
Hi, thank you very much for this opportunity. I represent People Inc. is an agency, human service agency in Buffalo, New York. I also am the chairperson of a provider association, the Developmental Disability Advocates of Western New York. We represent the Buffalo, Rochester, and Southern Tier area. So again, with our downstate colleagues, we were fortunate. Things traveled a little bit slower upstate to us, and we were able to learn some valuable lessons from our downstate colleagues. So quarantining, we watched what other folks were doing, And we fortunately, although we had some very, difficult outcomes, we were not as significantly affected as downstate. We also, the PPE, as Susan talked about, we worked across the state with caravans down to New York City to get PPE. Our local health department was not able to help us. But I guess I'd like to concentrate a little bit on the months went by. We quarantined our group homes. We had families that we were trying to support, but were home with individuals for 4 months at a time. We were fortunate. The Appendix K approval came from CMS, and we were getting retainer days to help us meet some of our expenses. But in July, all of a sudden, on the 10th of July, effective on July 15th, we were told we could open our day programs. It came as a bit of a surprise to us, but then we were told our retainer days on the day programs would be ending July 22nd. So again, with all the precautions you need to take, we wanted to be able to, especially for families, those were the first people you'd want to bring back to day program if it was safe to do. We weren't really sure it's safe to do. We are open very minimally. We are experiencing some, very difficult times with transportation. There's OPWDD has a lot of restrictions on who can travel in vans together. If you have a third-party provider, you are paying exorbitant rates. We are doing smaller units of service, but that is really affecting families. Nobody can work if your child's only gone 2 hours a day. We're asking you to provide the transportation. It's just really been a very, difficult situation all the way around for the group homes, for the day programs, for people living at home. We've also now had to go back to quarantining sites if there's exposures in the day program, which cuts off visitation. And I'm sure the families that are on this call are going to talk very much about visitation limitations. But from a fiscal standpoint, we have the human standpoint, we have a huge fiscal standpoint. We, with no retainer days and very limited attendance at our day programs, we still have leases, insurance, mortgages, programs that did not previously have a physical building. They're called Day Hab Without Walls, and it's a community-based program. We'd like to bring people back to that, but we need a place to do it. There's no way to pay for those costs. So we're struggling there. We're just struggling all the way around. And I think we've been rather, OPWDD's response has not been as quick or as flexible as we needed it to be. So thank you very much.
Thank you, Rhonda. Thank you so much. And I know that we've also now been joined by Senator Kevin Parker, and I will announce others as they join us. Thank you very much. Next, Al Kaplan, Senior Policy Advisor, AHRC NYC.
Yes, thank you for the opportunity, Senators, to speak with you today. I'm going to speak on behalf of the New York Disability Advocates, NYDA, and cover the basic fiscal situation of what's happening in COVID-19. These are very dark fiscal times for our field, and we're concerned about the future. Coming into COVID, as you know, the data showed that for OPWDD programs, not-for-profit providers, on balance, on a $6.5 billion program, have a margin of about 1%. That's about $66 million. That's about 4 days worth of operating funds that we come into this with. We did a survey of the first 3 months impact. That's NYDA did a survey of the first 3 months impact of COVID-19 from a fiscal perspective, and between additional payroll costs, additional PPE expenses, other general expenses, and decreased revenue across the board for our sector, we lost in those 3 months, March to May, $175 million. That's a combination of costs and lost revenue. And when we surveyed the field, we found 41% of the providers said that they were down to less than 30 days of cash. That's 41% is 250 agencies out of the 600 plus are seeing tough times with cash. So with all that, now we're being faced with this new cut that's supposed to go into effect in October of $238 million out of our residential programs and in-home programs. I mean, look at the math. With a margin of $66 million, they're taking another $238 million. That doesn't even include the $75 million on top of that that's being taken by the care coordination organizations. So that's $313 million in total cuts. And on top of those, we have this DAHAB billing fiasco and the new 20% holdbacks on contracts, which we're just starting to look to see what the impact of that's going to be. But I want to just quickly cover these cuts and vacancies that the state is pushing. Now, the thought is, well, it's a vacancy. No one's going to be in these homes. Why should the state be paying for that? Well, you all know that doesn't work. It doesn't work that way. These cuts are cuts in revenue, because when you start saying that we're not going to pay for the full days, that hurts. Now, we took a look at a 6-bed home, assuming that one person was gone on the 2 weekend days. What happens is, in that 6-bed home, that takes away 10% of the billing days based on the proposal, the proposed cut that's coming in October. That's 10%. Well, what do? Do you feed people 10% less? Do you take the overnight awake staff and cut that staff person by 10%? I mean, how do you work with that? It just doesn't make any sense. We realize that the real thought here, looking at the future of our field, is that the goal here is to reduce beds. And the sad part is this cut is being taken against the people who have the highest needs, people with severe disabilities that leave homes for certain periods for hospitalization, families that want to take their loved ones home for the weekend. Those cuts are going to lead to closing beds and closing homes, because we can't continue to operate these facilities when they're going to be cut by 10%. I use the 6-bed home because that's the average size.
I'm sorry, your time is almost up, but I'm being generous.
Okay. But just one, if I can, I'm sorry, I'm throwing out a lot of statistics at you.
That's all right.
But we saw, if you take a look at the difference in the enacted budget plan that came out in May, that report, and you look at the latest first quarterly report, the state itself dropped the bed count by 452 beds in their own report. And
okay.
and so we see it, and we see that the notion of over 450 people who lived in residences, DD residences, have passed because of COVID-19, and the state came out with a report saying we're going to stop funding those beds.
Okay, I have to cut you off. I appreciate that. We'll get to questions.
Thank you very much.
Thank you. Is Yvette Watts here? Okay, if not, we're going to go to Ron Colavito, CEO of Supports for Living.
Good morning. Thank you, Senators, for the opportunity to share our experience this morning. Again, I'm Ron Colavito. I'm the CEO of Access Supports for Living. I'm here presenting our agency's experience in the Hudson Valley and the overall impact of COVID on the IDD population through data collection of NYN, the New York Integrated Network. This time last year, like we were doing this year and had done every year before, we began the budget process for 2020. Never once in that process did we pause to consider the potential financial or human impact of the coming pandemic. We were as unprepared, quite frankly, as the state agencies tasked with providing the oversight and guidance. However, our agencies, while entrusted to provide critical 24/7 care to tens of thousands of people, with intellectual and developmental disabilities, many of whom have significant medical complexities, our field was given neither the distinction nor the resources that other healthcare providers were. We were left largely to fend for ourselves in securing PPE, and we did that at extraordinary cost and effort. As provider groups, we came together. We collected data on infection rates, hospitalizations, comorbidities, and death. We shared best practices and, unfortunately, grief. Among our sample, people living in 24/7 residential settings were 5 times more likely to become infected with COVID-19, 2.5 times more likely to be hospitalized, and twice as likely to die. Many agencies, Access included, created isolation units at their own expense to have a place for people we serve to continue to recover from COVID before returning to the home. We did this to prevent the spread of infection to other residents and help them recover. As you absorb that information, also consider that the compassionate, dedicated, direct support professionals working in these houses showed up every day. Many of them are parents, many are people of color, and none are getting rich working as a DSP. They are the definition of essential. So today, after increased staff expense and unforeseen costs for PPE that continue to this day, the field is facing enormous cuts. The expiration of funding to support day and community services during the pandemic has been difficult. Couple that with the devastation of the planned October cuts aimed solely at residential providers, and the field's entire fiscal sustainability is at severe risk. We know we're not alone and that cuts are likely unavoidable, but we need the state to be a willing partner with voluntary agencies to find cost savings together. Cuts of this magnitude will impact care for the most vulnerable in our communities, people with medical and behavioral complexities, and this will cause the field to move backwards in leaps and bounds, increasing the likelihood of a return to institutionalization. Thank you again for your time this morning.
Thank you, Ron. Thank you so much. I don't see that my Senate colleagues have raised their hands, but who would like to ask a question? And Senator Kaminsky, I see you.
Thank you so much. I just first want to give an important shout out to my predecessor, former Assemblyman Harvey Wiesenberg, who lives this issue every day and whose advocacy is an inspiration to us all. And Harvey continues to talk to me on a weekly, if not daily basis about this issue. So I'm really glad we're gathered here today, and thank all the senators, Senator Mayer and Carlucci especially for this. My question, I guess, is to Susan or to Ron. What is the state right now of your ability to stock PPE, assuming there's a second wave in the fall? How ready are you, and what do you need to do to get to the place you want to be?
Senator, currently right now, what we were directed in and what we had already started was to put together a 3-month supply of PPE. And we do have that. We have 3-month supply, and I think that the majority of agencies have the 3-month supply. We believe that in a second wave, which we'll be much better prepared for, we believe that the 3-month supply will allow us to be, again, to replenish that, but to not be caught short. So I believe that's what most agencies are looking at.
And if I could add, Senator Kaminsky, I would say very similar to Susan, the 3-month supply is what most agencies have and are prepared for, but we still are faced with higher costs than other healthcare providers. We do not get to leverage the ability of large healthcare hospital systems and otherwise. So we're often using the second, third, or even fourth level providers that add added cost, and quite honestly, probably not the same quality.
Okay.
Senator, if I could add just one other thing, because I think it's important. In New York City, the local health department has been working with us now, finally, after the emergency was over and we were able to really sit down with them. We meet with them weekly, and they have been providing PPE, and they tell us that that is something that will be available to all of the OPWDD providers in New York City. Will be the availability of PPE through the local health department.
Okay, just last thing for just for preparation's sake, assuming we are going to have a second wave, I guess both to Ron and Susan or anyone else who wants to chime in, if you could speak to city health, state health, OPWDD, what would you say to them now that you would like to share with them in light of your concerns about an upcoming second wave? What's the most pressing thing you don't think they're addressing or could address better?
What I would say firstly is that we need a policy from OPWDD on testing. Many of the agencies are trying to put into place testing. We've been working with our local health departments and with other of our connections in terms of getting our staff tested and getting our individuals tested. But we find that without a policy from OPWDD, we have pushback sometimes. So we'd like to see that policy established. And the local health departments should follow New York City. New York City is actually surveying all the providers, asking them what they need for PPE, what they have, and what they need for support and help. And that would be important throughout the state.
Senator,
In addition,
I'm
could
sorry.
I just ask one thing in addition to that?
Sure.
Also, a simplified and funded process to create isolation units. The original process here was so convoluted and created control of placement through OPWDD that providers just didn't use it and created their own units that they were able to stand up quickly, flexibly, and really protect people. So that's also a really important thing to prevent the most tragic consequences.
Thank you.
Senator Prasad.
Well, good morning, everyone, and thank you all for your testimony. Thank you for being here. First, I'm going to let you know my mom worked with the developmentally disabled population for over 30 years and just recently retired. And I have a brother who has embraced that field and is working in that field. And the things that he has gone through during this pandemic, I don't think anyone should. The organizations were ill prepared, and I still think there's a lot of work that needs to be done. So Ron, when you say, they're coming together and, coming with these plans and all the things that they're doing in preparation and making sure that there's an isolation area and all of that, they didn't have that. And I saw what my brother had to go through. He would call us and say he can't leave the facility because there was someone there who was positive and they can't leave, and they have him downstairs with that person, and they weren't giving them PPEs. So when you're saying that you're preparing, they're working on that, so you'll have the special isolation units. I think there's a lot of work still needs to be done. There was a lot of work. They're still not being given what they should be given. They're overworked, right? They're overworked, underpaid, and ill-prepared for the next wave. So if we could all work together to ensure that OPWDD and the departments of health understand this, I think we'll be better prepared. That's all I wanted to say. Thank you.
Thank you. I have a question. I have two questions. One is, I think this is for you, Al. Do you know how many providers provided supplemental pay to their workers to come in during this period and what that cost was? Because I know in my district, so many of the agencies paid, which was absolutely essential to get people to do what Senator Prasad just referenced, give up their own families, take personal risks, have to be basically quarantined in a group home in some cases when someone tested positive. So, and do you know the approximate cost of that added benefit?
Yeah, when we did the survey, we found virtually every provider in the metropolitan area paid something. And everyone paid different amounts. Some paid,
right,
a dollar amount. Some paid a percentage on the hourly, and we did also find, significant number of providers paid additional funds upstate, and a lot of it. Some paid for people who were working in homes that we call, hot homes, where there were people, with COVID-19. Others paid for various types of shifts. Overall, in the 3 months, March, April, and May that we had information on the latest survey, the amount comes to about $74 million in extra pay during that period. And I assume that some of that includes extra overtime because of various circumstances of having to go with extra coverage and all that. And as I said, just the PPE expenses alone were in the around $17 million for that period. And then other expenses such as housing, because in some cases we've had to house people that didn't want it, that's staff that didn't want to go home to their families, that were concerned about the safety of their families. So that was about another $10 million across the system during that period. So, that covers a lot of it, but everyone used their own means to be able to make sure that there was appropriate coverage. And a lot of it was just, paying extra amounts for the hours that were being worked.
And these sums were so far have not been reimbursable at all. And there's not. So that's my second question for the providers. What is the nature of your ongoing conversations with the commissioner or the governor's office about these problems that you've identified as a group of not-for-profit providers? And have you met with collectively with the commissioner to basically make the presentation you are making here today?
Well, the dollars that what came out of the surveys, all of that information was shared by the provider associations with OPWDD, the division of the budget. There have been letters written by NIDA that express these issues, express these amounts. I know Susan can speak more definitively to the precise conversations with OPWDD, but they have all of our numbers. We've shared all of this data with the executive branch.
But okay, well, I guess I'll ask Susan, have you met either in person or virtually with the representatives of the governor's office or the agency?
Yes. Yes,
so
we have, Senator. In the very beginning of COVID, we met weekly we met daily, with OPWDD 7 days a week. We now meet once a week with them virtually. We have explained clearly what our concerns are. Many of us have met also with the governor's office, have spoken almost weekly with the governor's office. What we hear is, of course, there is no money. What we've been asked to do is to be sure that we apply for every single bit of federal dollar that is available. And all of the providers have done that. And it's a mixed bag because of the sizes. If you're over 500 employees, you couldn't get PPP. And if you're now this or that. But we keep looking at that, but we do understand that they tell us that will be used as an offset against our expenses, and it will be, there will be a reconciliation to this. The providers really do not know what to do. We are at we've tried to approach them on this cut that's coming in October, but there's very little discussion on that, It's like it's a fait accompli. This is what's going to happen. So I will say that in past years, we've always had much deeper and actually have always been involved with OPWDD when there were going to be cuts, so that we could be really looking with them at what the impact was going to be. That did not happen this time. And there really has been very little conversation about the October cut at all.
Thank you. Do any of my other colleagues have questions? I don't see any hands. And Monica, unfortunately, Senator Martinez, I cannot see, but I don't think your hand is raised. So thank you, panel one, for really setting the stage for, and I would ask you, Mr. Kaplan, to make sure you, there's Senator Martinez, that you share your, the data you have collected with Senator Carlucci's office to make sure it's distributed, that we have the details of this fiscal loss and the actual costs that the providers have borne. So thank you all very much. I'm going to move to our second panel. First, and I know we saw him earlier, Harvey Weisenberg, former assembly member, my colleague when I was in the assembly, a lifelong champion, and we're so pleased he could be with us today. Jim Carpe, President, co-chair of the Queens Council on Developmental Disabilities. Leslie Feinberg, founder of Soyen, supporting our youth and adults network. Barbara Mazer, one of the directors of GROW, which is a Westchester-based advocacy for families of those with developmental and intellectual disabilities. Michael Sweeney, director of Endeavor 21 Plus. Kathy Bruce, co-chair of Developmental Disabilities Alliance of Western New York. And Margaret Vogt, a parent, happens to live in my district and has been an outspoken advocate on behalf of her child and others with developmental disabilities. So we will start with you, Assemblyman. It's a pleasure to have you back. Really, we miss your presence there, and I'm glad you're filling Senator Kaminsky's ear every day on the issues that matter.
It's really my pleasure to be with you. I would like to thank an opportunity to thank you and the Majority Leader Cousin, Senator Carlucci, and of course, Senator Todd Kaminsky, who's doing a wonderful job advocating for all people. It's very important for me to be able to listen and learn. You know, God gave me an angel, a saint, and a mission. The angel is a special child who can never speak or cry and is blind, but gives love. And the unconditional love of a special child is like no love anybody could ever experience. Secondly, I really feel that is vitally important in the fight that I've been involved with, that I listen to the people that just spoke. And it's very interesting. We're all saying basically the same thing. We need, we should have, we want to have. And I'm going to get into trouble like I always do, because what I'm saying to you is we have to really understand the basic needs of who is being impacted by the lack of resources to be able to provide a health and safety environment, but not only the residents that we have, but our staff. You know, we're interested, and the world is changing, and we're more aware now that women are not being paid sufficient money as the jobs that they do. And most of all, I'd like to make people aware that I would say about over the years, and I'm involved for over 50 years working with our special children and people, that people of color, overworked, underpaid, and we want to be talking about acknowledging people of color. At least 90% of the people that I know are working as direct caregivers. And then when I say direct caregivers, that's a title that is so just, I ask people, what is a direct caregiver? They don't know what that is. They don't know who they are or what they do. And I think we do know, and I begged the governor on occasions, give me 1 hour, come with me, come to a group home, let me show you who they are, who the people are, what they do. They're trained professional people dedicating their lives to the services that are necessary to be able to have a quality of life in a safe environment for people who have developmental disabilities. And it's really very interesting because your heart breaks, because I can tell you stories how dedicated these people are that are taking care of our families, that they need to be able to have the resources that are so vitally important for a quality of life. And 17% of the people in our state, direct caregivers, have left. A couple of years ago, it was 14%. And who was going to take a job as a direct caregiver when you say, well, this is your job. The most difficult job in the world is taking care of another human being. And these are people that are dedicating their lives. And it was brought to view by other speakers prior to me saying that they have their own families. A lot of these women are single parents with children at home, and they are there taking care of our families. And our families are just so lucky to have the love and care that is being given by these people. Quick story. People are leaving, they can't pay their bills. And I've been involved with the legislature, and who are the most important people that I'm speaking with and to are the legislators in the Assembly and the Senate. This is one big family. I had an opportunity, we brought them all together. we put in the last couple of years, we put in $145 million that was not going to be in that budget if it weren't for the voice of those who have no voice, the elected senators and assembly people who reached out and made people aware of the importance of having these resources to be able to do the jobs that have to be done. And this is something that I have a prepared speech because I didn't have an agenda. I didn't know who was going to be there and who I'm speaking to. But the answer really is I'm speaking to you and I'm speaking to everybody that's listening. And I want people to understand God put our children here. God put our children, gave us, and I say, the most wonderful gift that I share with Ellen. Ellen's happiest days were Ricky days. And I tell you, the love that you get from a special child I defined before. And we used to have a wonderful day together. It was a happy day. And when we went to leave, Ellen would leave and she would cry. Now Ellen's not here with me anymore. And I'll tell you, I go with Ricky and my daughter, and I go to Ricky at least twice a week. But for 3 months, I didn't have that opportunity to be there. And then at his birthday, I sang and talked to him through a window for his 62nd birthday. He can't speak, he can't cry and is blind, but he gives love and he has intelligence. And I want you to understand the caregivers are surrogate parents. And what bothers me the most was not a one word was written about people with developmental disabilities in our group homes. How many people were tested on Long Island? We have 5,000 people here. How many were tested? How many were positive? How many passed away? And I want you to know that people in some of these houses, they live and they outlive their families. And who do you think become their families? Direct caregivers. And then when they lose one of theirs, they lost a person to them that's like their own child. And the stress, the post-traumatic stress that is being there, the depression, the fact that this job, you can't move up, you don't get promoted. And all you're looking for are the thank yous and appreciation. And I want to share this with you. I was so concerned about the PPE that I donated $10,000 to a purchase of masks and other necessities for Ricky's house and others like it. Well, I would do it all over again to save lives. I am deeply troubled and have many questions about what exactly the regulatory agencies have been doing to ensure safe staffing, a living wage for workers, guidance and support, and the necessary equipment to protect Ricky and all residents and staff. It is my understanding that Disabilities in New York has filed a federal lawsuit over what appears to be shortcomings in this regard. Additionally, Newsday have revealed some grim circumstances in our group homes, and the state controller is in the process of conducting an audit. It is my sincere hope that this roundtable and other efforts will result in major improvements in how we can, for our most valuable citizens, how we can care for them. Specifically, I am interested in detailing a timeline and through a review of guidance and support provided by OPWDD, the group homes in our state, and what, if any, was the role of the New York State Justice Center, with the sole mission is to protect those vulnerable citizens. This is vitally important to me. Because
Thank you. We've given you, because of who you are, we would have you on for a long time. And I so appreciate it that you're here. We'll get back to you when we get to the questions, if you don't mind.
I look forward to the questions. Thank you very much for this opportunity.
Thank you. And I know many people are watching on Facebook and some people have questions. We are going to try to get those addressed as well. So next, Jim Carpe, President Co-Chair, Queens Council on Developmental Disabilities.
Thank you for this opportunity to talk, and thank you, Harvey Weisenberg, for your words. I'm Jim Karp. I'm the father of 2 young adults with special needs, with IDD, and our subject today is how COVID-19 impacted this population. And so much has changed. I'll keep to the 3 minutes. And in those 3 minutes, I want to talk briefly about 3 subjects: fatalities, flexibility, and foolishness. So much has changed, but let's start with what has not changed. What has not changed is we need a wide range of solutions to meet a very wide range of needs. During the pandemic, we had a huge range of experiences. Some of us experienced only minor inconvenience, but we were, as a society, caught flat-footed, and over 400 individuals with IDD paid the cost. And the vast majority of those, of course, I think everybody already knows, were in downstate congregate care facilities. And that's tragic, and we need to acknowledge that, as Harvey just spoke so eloquently about. In contrast, my son's experience was very different. When New York State went into pause, his life and community went on halt, just as most of our lives did. And thanks to the flexibility that the system found to start tele-delivery of services, he was able to pretty rapidly start interacting with his direct service professionals again. And so I do want to pause here and acknowledge the progress that the system took. It took a disaster, but we entered the 21st century, and that's fantastic that we had that flexibility. I want to urge that we continue with that flexibility and expand it, because in keeping with the idea of a wide range of needs, there are some people for whom teledelivery just doesn't work, remote services. There's other people for whom it works, but only if they have somebody there alongside of them who can help them to be online. And that's just not allowed by the system today. It's considered double dipping. If I'm participating in this, which is Medicaid funded, and there's somebody Medicaid funded assisting me, that's not allowed. So my son did okay. He was able to take advantage of the flexibility. But now I'll very briefly talk about the foolishness, because I don't want to go too far over my time. And it's a particular type of foolishness. It's penny wise and pound foolish. My son's living in a subsidized apartment, which costs the state of New York about $10,000 a year. Due to the 20% withhold, he's at risk of losing that. Now, he has me and we'll find a solution, but there's thousands of New Yorkers who the only alternative to living in their own apartment, when they lose that 20% subsidy, when they lose 20% of their subsidy, their only alternative will be to either move into a group home at a cost 10 times as much, or homelessness. And neither of those is a desirable alternative. So I'd like to have you consider the 20% withhold. I did go a little over, my apologies, but
That's all right.
Thank you for this opportunity today.
Thank you. Sorry I mispronounced your last name. That was my mistake. Leslie Feinberg, founder of Soyan. Leslie, are you there? Can you unmute? There you
Here I
are.
am. Sorry, just took a minute.
That's all right.
Thank you. I wanted to say thank you for this opportunity, for sharing the journey of what it's like to have an intellectually and developmentally disabled young adult as a family member, and to give voice to the other families that are part of Soyan supporting our youth and adult network, who are also on the journey of self-direction. Thank you to, and I wanted to welcome you into my home. This is my son's room. He's not here. Don't worry. He's okay. He moved out. It was his dream by the time he's 30 to be able to move out, just like his twin sister did many, many years ago. And he has last year. And that was all because of self-direction. Self-direction, you know, it sounds like it's just for people like my son who, you know, with the right supports can be independent, but it's really for everyone. So self-direction serves children, adolescents, and adults living at home in the community with a large range of disabilities, people who otherwise would be in congregate settings. And, you know, we've all heard about what the pitfalls were of OPWDD's lack of guidance and leadership, and the cost it took. It had taken on folks in congregate settings, and my heart goes out to them. And it's really sinful, actually. So we've heard a lot about how OPWDD's failure to provide leadership and communication has affected the provider agency and the families who relied upon those services. But let me just tell you a little bit about how OPWDD's lack of communication and leadership has affected families like mine who are on the self-direction route. So we shut our doors. We shut our doors because that's what we were told to do by the governor. We all did, right? So, and then we were told to have PPE and nobody, you know, and be careful. So our devoted direct support staff who was coming into our homes stopped coming. OPWDD at first did not provide any PPE, and that's where Swain comes in. Through the network of families here on Long Island, we have a devoted sister. She's actually the older sister of someone who made it her business to connect with local merchants who understood that she was gathering stuff at whatever the cost was. She was just giving it away to people. So that's how we got Clorox wipes. That's how we got PPE. I started making some and sharing and sending it to families, you know, masks. So it's the connections that we've made that have really supported the families in the self-direction journey here on Long Island. And if there are families whose adult children were living on their own, unlike my son, who with some support, and he lives close by, was able to manage it in spite of the fact that his twin sister said he should come home. But he said, no, this is my apartment. But I have other friends whose adult children were living on their own, but really required 24/7. So without trusted direct support staff allowed into their homes, they had to bring them back to family residence. And for some families, that created a hardship because now, just like families whose adult children were in day program, how does a person go to work if they're caring for someone who has 24/7 needs? So we had asked OPWDD to look at the waiver, the home and community-based waiver, because in there, it says under extraordinary circumstances, family members could be paid. Well, they told us that that the pandemic was not an extraordinary circumstance and that did not fly. Wow. So families who had to stop working for whatever reason, whether it was because of the shutdown of day programs or resident programs or self-direction, families were left in the lurch. So the burden to families is extraordinary.
And Leslie, you have to wrap up. I apologize.
Sure. So we were also provided for a brief stint staff retainer payments. That really was without proper guidance. That kind of went by the wayside. They changed the rules under the revised Amendment K. So it's convoluted and confusing, and the FIs, the fiscal intermediaries that manage the money for the self-direction families, don't really know how that works. And our budgets have been frozen, and we don't know why, and we don't know when that's going to be released. So if a person's budget, their budget is reflective of scores on need, and if their needs have changed, their budget's frozen, they can't get any additional help, and we don't know when that's ended either. So
I'm gonna
thank you.
And you then. Thank you very much, Leslie. Thank you. Next, we have Barbara Mazur, the Legislative Chair of GROW.
Hi,
Barbara.
My friend Shelley. Yes, unfortunately, Stacy, our president, is temporarily indisposed, and we're hoping that you will see him very, very soon. Many issues. We have always been supportive of our agencies, and we feel the lack of funding that they have been receiving. And this has already affected our members greatly. We really called for a 14-day quarantine of any caregiver that was tested positive for the COVID. This was a mandate for the nursing homes. We were told that The agencies could not afford this, paying for sick leave and everything. And after the initial wave, our children were locked down in their homes. The only outside people were the caregivers. And yet, if they contracted the COVID, they could conceivably come back after 7 days. We also wanted them to be mandated for testing. That still is not the case. So we could not see our children. We were kind of treated like the enemy. I think a lot of us parents would have been willing to be tested, to go in, no. And even now, when they are allowing in-home visits, most of the agencies mandate that you can only visit them outside, which might be good for now, but comes the winter, not going to work. Also, because of the lack of funding that the agencies have gotten, people who want to go back to day-hab are not able to, because the agency is doing day-hab in their homes and getting reimbursed for it. So why not go to another agency and take their children? So that will be new money for the agency that's doing the day-hab. And yet there are people who do really want to go back to on-site rehabilitation, which leads me to the issue of masks and the funny guidelines that people have been using. We all know that masks are effective. And in the real world, everybody would wear masks. However, people with developmental disabilities, by and large, don't understand why they need to wear a mask. A lot of them, my son, very tactily sensitive, doesn't want to wear this, doesn't want to wear that. And what has happened is when he was going to his day-hab program, the matron said, no mask, no ride. Even though they fulfilled all the guidelines, the only other people on the van were people from his group home that he has been with for the last 5 months. They were going to a program where there would be 4 in one class, 4 in the other, same people that he's been with. And the only new people were the van driver and the matron, who do not need to be tested. So we succeeded in getting my son to wear a mask, but there are many, many, many other people who have been excluded from the van. This is in Westchester County. And I know that the Joan Volpe, the director of Region 2, is looking into this.
Barbara, your time is almost up.
Okay. All right. I should reiterate that they must have a plan for isolation. In many people share homes, or share rooms rather, in the residences. My son was forced to sleep in the living room for a week. You must have that, and you must have more flexibility as you're opening up. And parents and guardians are not the enemy. We want to be in to work from the beginning with OPWDD.
Thank you very much. Kathy Bunce, I'm sorry I had your name wrong before, co-chair of Developmental Disabilities Alliance of Western New York.
Hi, thank you for the opportunity to be here with you and for your attention on this issue. I want to first thank all the participants here today, and especially those who have chosen to make this this work of serving people with disabilities their life work. I didn't choose that, it chose me. I'm a mom. My daughter is 25 years old and she lives at home. She has complex developmental disabilities caused by what we've learned is a genetic mutation. We learned that when she was 19 years old. So for the first 19 years, we saw lots of providers, lots of medical professionals, and lots of nothing. So it's rare, it's unnamed. And the result is, you know, she operates at a 2-year-old level. She requires total care. She has seizures and she has multiple physical challenges. I'm here today on her behalf and on behalf of the thousands of people with complex medical and behavioral disabilities. I serve as the co-chair of the Donny Family Committee, and I'm on the organizing membership of SWAN. And because of that, I do have the opportunity to participate on those weekly calls with OPWDD leadership, and frequently are asking these questions to OPWDD leadership. So that question earlier today, yes, they are hearing from family caregivers and from agencies as to what the issues are. And so none of this is new news. I've worked for 15 years at a nonprofit, began as a volunteer, and then for 15 years have been employed. So about 25 years, close to my daughter's entire lifetime, I've been involved in this area. And they provide educational support to people with autism and severe behavior disorder. So I've gotten to know hundreds and hundreds of families, and it's been a wonderful journey and a privilege to support them and work with them and advocate on their behalf. What I can attest to pre-COVID is that our system was at a tipping point. There were low wages, long hours, very difficult work. And it was paired with rate rationalization, over-regulation, limited program models that threaten the sustainability of the system that we all depend on. Now we've lost people, we've lost access to the community venues for things like Day Without Walls. We've seen increased horrific costs for PPE, increased regulation and rules that limits capacity and transportation. Families are worried, they're frustrated, they're struggling, and they're losing hope. In Region 1, we've conducted a survey on behalf of OPWDD in anticipation of a call next week to see how things are going for families. And the survey told us pretty much we have first round of results. Many of those with higher capabilities are managing all right. You know, they're able to participate in Zoom calls and online support, and in some cases have returned to DayHab, which is wonderful. However, those with high needs are not. It is not wonderful. And I can share many stories of families. There have been many calls that are happening all over our region. We have a young man with autism who graduated in June of 2018 and has not had services since June of 2018. And fortunately, there are 2 parents in the home who provide round-the-clock, 24-hour care for this young man who is extremely behavioral and isolated and losing those skills that he gained after a formal education up until the age of 21. So it's heartbreaking to see. Another young man with autism.
Your time is up, so draw it to a close, and I apologize.
Okay. Our loved ones need to be protected. They deserve to be protected. It's time to make people with disabilities a priority. These cuts in funding are going to be cuts to safety for our loved ones. And the agencies that do this great work support 87% of the people receiving services in the system. We can't afford to lose one more agency or one more person working in the field because lives depend on it. And
thank you. Thank you very much. Thank you. Next, Martha Vogt, a parent. Hi, Martha.
Nice. Hi, thank you so much for giving me this opportunity. And I'm so glad, Kathy, because I feel like I'm going to follow right along with what you were saying. My daughter, Diana, has an intellectual disability, and she lives in an 8-bed IRA run by ARC of Westchester in Westchester County. To say that I was horrified to read about the severe cuts to funding for IRA residential services, doesn't come close to how awful that whole idea is. For starters, to penalize provider agencies for having vacancies in IRAs and ICFs when a number of those vacancies are the results of COVID-19 deaths is appalling. Our DD community has been devastated by the virus, with thousands of our family members and staff getting ill and hundreds losing their lives. The rest of the community is going to take a very long time to recover from this. To compound the tragedy by taking $200 million of funding away from the developmentally disabled residents is truly adding insult to terrible injury. Instead, New York should be celebrating the tremendous courage and sacrifice shown by the direct care staff and the patience and bravery shown by the residents of the IRAs and ICFs who have endured isolation, fear, and illness while experiencing the deaths of beloved housemates and staff members. Cuts like these will inevitably result in erosion in my daughter's quality of life and possible safety. Furthermore, it will put her in the position of eroding the quality of life of her housemates and friends. If she chooses to visit her family or travel for learning, healthcare treatment, or recreation, her friends and housemates will suffer the impact of reduced funding. Plus, there will be an enormous incentive for the people creating her life plan to leave these kinds of activities out for fear of the fiscal impact. Will IRA staff send residents to hospitals for needed care when they are strongly financially incented not to? Will I now have to worry if Diana gets sick and needs hospitalization that she will not be able to return to a home she has lived in for years because her place had to be filled? I know that ARC Westchester is a wonderful agency and will do their best for Diana, but in 25 years of advocating for person-centered and community-based services for the developmentally disabled, I have seen the impact that financial incentives can have on even the most well-intentioned. Do not add yet another fiscal obstacle to Diana's effort to live a safe, secure life where she can make at least some of the choices about how she chooses to live, how she wants to live. I know that there is not enough money to go around. I know this truly. My daughter and others like her are dependent on New York State to live their lives safely and with human dignity. Please give them that opportunity.
Thank you very much, Margaret. Thank you, all of you, for what you said. Senator Liu wanted to make some remarks, and I do want to ask some of the questions that are in Facebook from families. Senator Liu.
Thank you very much. Sorry. Thank you very much, Madam Chair. I want to thank Senator Mayer for helping put this event together, and Senator Carlucci. The issues and the problems we have heard this morning already, unfortunately, are not new. I've heard them from my constituents. I know my colleagues have heard them as well. We haven't always heard them directly from the service providers, but certainly have heard them from advocates and parents, such as the ones that we've heard from already. I've got many families who have either children or relatives with developmental disabilities that suffered immensely through this COVID crisis, whether they be in some of the group homes in our neighborhoods, or whether they be children with special needs who simply were not able to get any kind of learning done remotely. So these are issues that we need to deal with legislatively through oversight and to help however we can with some of the budget issues that the providers have talked about. I wish I could offer solutions right now. But it's important for us to continue to listen to all of you, to hear some of the suggestions that you have for us so that we can continue to put our heads together and help individuals in our communities. People with developmental disabilities are very much part of our communities and our constituents, and we need to continue to pay attention to this. So I don't have any questions per se. I just wanted to thank all the people the advocates, the service providers in the earlier panel, and the service providers in the next panel that we learned from. Thank you.
Thank you, Senator Liu. I want to ask this question. It was in Facebook. It really goes to the heart of this. It's just not acceptable to put providers in a situation that they may have to stop providing services or closing their doors. They've had to spend more than $100 million on additional costs because of COVID that have not been reimbursed. It seems the response that the governor's office doesn't understand and wants to take another $238 million out of residential services and remove state-funded services. The bottom line is these cuts run downhill and directly affect people with disabilities and their families. What are we to do? Mr. Weisenberg, you want to respond to that as someone who's been on all sides of this issue?
Yeah, it's my pleasure. It's my pleasure. And I said this before, and from life experience, we were involved a few years ago when $90 million was taken out of the budget.
I remember.
And this is unbelievable. And I asked, do you understand the consequences? And I don't want to make this personal, but the reality is the person who was taking it out, his mother worked in a group home, and his father and I worked together for many years. And I'm saying that you have to understand the consequences. And they didn't care because the government can do this. But I'm watching what's happening at every level of government. And today, and I'm talking to everybody who is participating here today. The most important people that you're going to be talking to are the people that were elected by the people. They are the voice of the people, and they should be making decisions. They pass laws. They run the legislation that has to be done. The governor can sign it or veto it. But the answer really is governor proclamation shouldn't be running the government. And you are bringing to view hundreds of thousands of people in the state of New York. And we're bringing to view the fact that we have a real serious problem for the developmentally disabled, the group homes, people that have a need to be able to survive and have some quality of life in a safe environment. What more can you ask for than that? And the best people to ask and to make sure is the ones who put out the budget. How much money in the budget this year for not-for-profit group homes? From where I know, nothing. And 80% of the services that are being given in this state are by not-for-profit agencies or group homes. These people are the ones who are doing the majority of work. You want to go back to Willowbrook and Wassaic, where my son was almost starved to death, almost scalded to death in his young life? No, we're not going to have these state facilities. O.D. Heck, where Jonathan Carey died at the age of 12 by a person who worked 10 consecutive double shifts and restrained a child with autism, and he killed him. He went to jail. He lost a child. Why was this person working 10 consecutive double shifts? And I brought to view, I don't know if you've all picked up, at least 17% of direct caregivers in the state of New York have left. Who's going to be taking their place? I mean, who wants to take a job? I'm asking each and everybody here. You have a child going to school, going to college, and you say, when you grow up, I want you to be a direct caregiver. I mean, look at the hardest job in the world. Are you kidding me? No chance of advancement in moving up a ladder. They're doing God's work, and we have to protect them and our residents. And the people who can do this are the people that are elected as a senator and an assemblyman to get together and say, these are our priorities. People, not power and money, people. These are the people that need the resources you're bringing to view. And they're cutting more? Are you kidding me? Let me tell you, God bless you all for participating, because every one of you became a messenger. And we have to make people aware. I wrote a book, and I'm not pushing the book because the money goes to charity. It's called For the Love of the Child. I'm getting phone calls from all over the country, saying, God bless you. Thank you so much, because I'm making people aware, even in your own families, where they don't, child with a disability, they're different. We don't want to be involved. We don't want to know about it. And the answer really is everybody has to at least care. And you are caring people, and your voice is going to be heard today. And I thank the Senate. As a matter of fact, I just got an acknowledgement that the Assembly is going to entertain my request to have hearings on this. And by the way, I did something that I never did before. I'm not campaigning and I'm not running for office, but I sent it out in Spanish to every Spanish agency. And you can't imagine the response that we're getting, because minority people are the ones that need this information and resource the most. And I also say this, don't focus on what our kids can't do, but what they can do. And I'm telling you the miracles that have come to view because people are taking the time to understand and focus and do things. We have not-for-profit agencies that have performed miracles. I have a surfing program that I've started for people with disabilities in Long Beach. We have hundreds of children surfing, one without legs, one with arms. But you know what? They can do things. All we have to do is give them the wherewithal. And we have God-loving people taking care of our children. Direct caregivers. They're like my family. I paid dinner. I sent dinner to my family, to my house, because they work double shifts and they need funding. I mean, they're gonna buy dinner for themselves. I mean, an agency. I just want to finish. And one other agency that I mentioned, I gave them $10,000 last year for many medical supplies to be able to provide what is necessary, because government is not giving the funding to where it really belongs. And now you're saying they're taking it away. God bless you. Thank you for your participation and your support. I'm talking to you as a parent. God bless you.
Thank you, Harvey. Always powerful. I have another question that I know comes from my own conversations with the parents in my district. Do you, as a parent activist, any of you feel that your voice is heard on a regular basis by OPWDD? And if not, what would be a more effective way to be ensure that, I understand the providers have calls with them and some of the parent community as well, but is there a more effective way to ensure the voice of a Harvey or Barbara, Margaret, all of you, Kathy, Jim, is heard by the agency that is making proposals or by the governor's office? If any of you have something specific. Yes, Barbara.
There used to be something called a correspondence unit. And whenever a new paper came out, a new guideline, a new survey, a lot of people got it. That has been discontinued. What some of us are participants in, Kathy and Jim and myself, are these updates. And the agenda a lot of times is really set by OPWDD. We're given information. We're not part of the group that devises the plan. It's yes or no. And sometimes when we give a response, we'll get back to you. So I would ask that correspondence unit be revived and expanded, so someone like Margaret could get information, and that we really be ongoing part of a conversation from the ground up, not yes or no.
Thank you. And Leslie, and I see Senator Carlucci is joining. I'm going to turn it back to him after Leslie speaks.
I wanted to add to what Barbara said. Yes, Soyan is participating in those. Now they're bi-weekly calls with OPW. And there's a difference, I think, between being heard and listening. So I think they're listening, but I don't think they hear, or however you want to choose to say it. Because, and whenever I have an issue that develops from these conversations, these Zoom calls that pertains to self-direction, they're willing to break off and have a meeting with us. And we're spoken to. As Barbara says, we're not part of the conversation that's making a decision. I mean, I know when self-direction started many, many moons ago, it was parents that were on the ground that were part of the conversation that made it happen. And those parents are left out of the conversation now. So, the difference between, the difference between the provider agencies and the self-direction is provider agencies are many people and many organizations,
Right.
and they have lobbyists. We in the self-direction community don't have lobbyists. We have advocates like me and Jim. And so we're out there on the ground trying to help families understand what's going on. And there's really no give and take, as Barbara said.
Yeah.
Do they hear? Yeah, they hear. Are they listening? I don't know. So I think the regional offices of OPW are not being used to the fullest. I think, especially for self-direction, there needs to be ongoing communication that happens in real time so that we can share information in real time and get real answers, so that the flexibility of self-direction is maintained, and our adult children, or our children, because there are children in this, their dignity is maintained, and the whole purpose of self-direction moves forward. Because, like I said, it's been saving the money, it's been saving the state money, but the expense has been on the backs of the families.
Thank you very much. Before I turn it over to Senator Carlucci, and thank you to all, I want to acknowledge not only the direct care workers, as Harvey said, they shouldn't have that title. I know during the pandemic, I went around and made it my business to thank them personally as essential workers who were sort of ignored in this conversation of the first few months of the pandemic, when they were really at the forefront. So many women of color, so many low-income workers making at the bottom of the pay scale. That's something that we as a group have to address. I think we all are very committed to that. And I also want to talk about the families, Black and brown families who have children, adult children in this circumstance, who we don't always hear their voice, but we are here to make sure their voice is heard. And this is a statewide issue and a statewide problem. And I want to thank Senator Carlucci for putting this together, because I know I went to him, and I'm sure many of my colleagues do, and said, we have to address this issue. So I appreciate the opportunity that he put together here. And with that, I'm going to turn it over back to him.
Thank you, Shelley. Thank you, Senator Mayer. Thank you to everyone for joining us today. And that's exactly right. The reason we're here is because we have to hear your voice and make sure that New York State is listening. So I want to thank you for just putting this on today and letting it go without a hitch. Sorry for my tardiness. And the good thing is we're recording all this, so I'll be able to watch it again and produce a report from this. And I want to thank my colleagues, Senator Liu and Senator Felder and Senator Prasad, Senator Martinez, and Senator Sepulveda, I know, has joined us. So thank you all for joining us today. Thank you, Harvey Wiesenberg, our former assemblyman and champion, and Barbara, it's good to see you at Grow. So with that, we're going to turn it over to our next panelist. We have our third panel that's up. So I'll just introduce them and we'll keep it going. Let's see. Okay, so we have from the Arc of Rockland, Jane Zeman, who is the Chief Program Officer. We have Mary Grace Giuliano, the COO of the Institutes of Applied Human Dynamics. And we have Sally Coletti, who's the CEO of Advocates for Autism, and Marjorie Watson Lay, who's the controller of Another Step. So I hope you're all able to hear us. And Jane, why don't we start with you?
Okay. First, I'd like to thank you, Senator Carlucci, for including the ARC Rockland in this presentation. Thus far, it's been extremely helpful, and there's been such a volume of shared information that everybody needs to hear. I had intended to give a more global perspective to our thoughts on this, how the pandemic affected the developmentally disabled, but after listening to everybody, I support and endorse whatever has been said thus far. So rather than reiterate, I think what I'm going to do is take this in a more personal context and kind of describe what the COVID-19, the impact it had on a mid-size agency, the Arc of Rockland, in the southern district of the southern part of the state. The southern part of the state had a unique experience, as everybody's mentioned. We had the vast majority of the cases, and we had to learn very quickly how to handle them. This perspective is very unique to the ARC Rockland. We're a mid-sized agency. We support about less than 200 people residentially. And the tragedy affected us. We had 9 people in our residence pass away. We had people who passed away in the hospital. We had people who passed away in our homes. It was tragic, and it was an event that nobody is ever going to forget. We had additional people from our day supports who also passed away. We support 400 people, and we had probably about a dozen who were living at home or in other agencies that we lost. We had total of over 60 people in our residence, of just under 200 who tested positive or were presumed positive, just to give you the magnitude of the impact this had on our agency. We had over 100 staff who tested positive out of our close to 700 staff. And unfortunately, we had 1 pass away. This is what happened in a less than 3-month period from mid-March to mid-May. It was a whirlwind that we experienced. During that period, we continued to operate our residential programs, our IRAs, just about 30 across the county. We provided virtual day hab, as many people alluded to, where we would connect with Zoom or other methods to the people who we had previously supported. And we did the same with our preschool. Our preschool continued to operate, and the teachers did remote learning. We are currently in a new phase. It's a different phase. It's the reopening phase. We have, as somebody mentioned, the retainer payments ended on July 21st. As of July 22nd, we were operating our day hab services as much as possible in our existing day hab site-based programs. We began in-person day hab, and while we continued the virtual provision of services. And we expect that after Labor Day, we will be opening our preschool in our school environment. We will stop the virtual as much as possible unless families prefer that, and we will be meeting our preschoolers for the first time in September. Well, all of this, there's been some positives from this. One of the things I have to say, and a number of people alluded to it, we learned certain things. A lot of that learning we had to do by ourselves or with the support of the provider community and the families. We learned about infection control. We learned about how to contain a virus. We learned about how to reach people virtually. And we continue to do that. That was a whole new learning curve for us. So those are positives. And that's very important for us to keep that in the back of our mind if we have to have a quick close or if we go into a second phase of the virus. We know what to do now for the most part. There's more we have to put in place, but we have a good foundation and a good basis. I think the future is what concerns us the most. Many people alluded to the cuts. Again, we're a mid-sized agency. The cuts themselves to residential services, we anticipate a $1.7 to $1.8 million cut to our IRAs alone. We cannot sustain that. And we're working on plans to try to mitigate that. We need to keep the agencies from failing based on some of these cuts. That's just residential services. Right now, I mentioned we started to provide day hab services in our day hab, but whether it be without walls or in our community-based locations. We are currently providing about 43% of the day hab that we had provided pre-COVID. That's unsustainable. We've had to let staff go. We furloughed people. We've laid a lot of people off our work just in order to continue to maintain the agency. We put people on therapy. In this retainer program, as a couple of people mentioned, it includes the vacancy factor. The retainer program is when people are in hospitals. They're not going to pay us for that, as well as when folks go home to spend time with their families overnight. That's going to be devastating. Our preschool is opening, I mentioned, in September at less than 50% capacity. Again, how do you sustain something like that? How do we keep the good programs that we've worked to develop for the past 60-something years? How do we continue to maintain that? And if we're feeling this as just one of the many agencies in Rockland County, I am sure particularly those downstate that were most directly impacted, are going to feel the same thing. So I just wanted to thank everybody and give you basically what we're feeling and what is a typical agency is undergoing at this point. The losses of life was tragic. It still smarts, it still hurts. And we still have the, it's almost post-traumatic stress syndrome. The agency itself is feeling that. We can't go through that again, and we've got to do things differently. So thank you.
Jane, thank you so much for sharing that with us. Next, let's move to Sally Coletti. Sally, thank you.
Good morning. Ironically, as I sit here, I am sitting in a medical office. First and foremost, I am a parent, and I am a parent of a 27-year-old man with what's considered atypical autism. I'm sitting here in this medical office because I have to live forever. There's no other option. Doesn't matter whether it's a group home or a home of his own. He is one of the very first gentlemen in New York to use his special needs trust to own a home when his grandfather passed last year. He's a full-out homeowner with a half an acre of land. I'm doing the vaccine study, and I just received my first injection. It was very, very scary, but all of this has been very terrifying. So I will just go quickly with what works well. First of all, I want to shout out to Harvey Wiesenberg. How you doing, Harvey? We've been together advocating on and off over the years, and he was instrumental in a lot of the first responder training funding. He was also instrumental in helping to remove mercury ironically, from vaccines in New York State. He heard us loud and clear. He always has, he always will. Thank you. Also, thank you. I know he's friends with the Fishkins, and we have Dan Fishkin as a great testament to you can endure this. We will not have another round of this. That's why I'm sitting in this room. Anyway, I founded the Autism Society of America in 1995 when my son was diagnosed. And during that same time, I've also worked in the healthcare field. Hopefully the word DISRIP is not a foreign to the senators. You're very fully aware of what our DISRIP program did. We took $8 billion and we saved Medicaid funds. Just by reducing readmissions, we saved $50 million in Medicaid funds. Doesn't sound like a lot, but boy, if we did that for every metric that we went to measure, we would really, we did it. We did DISRIP. So hopefully the Medicaid redesign team too will continue on with our efforts. In the meantime, I live at home with my 27-year-old son. I am a broker for the self-direction program that has been mentioned by the advocates, and so eloquently so by the parents. I was one of the first of 3 brokers in New York State selected for that program back in 2005. My son also had a plan then. So I've brokered over 400 plans across New York State in every DDRO with over 7 different FIs involved. So instead of talking about what went wrong, let's talk about what did work. What did work was I think it was pretty quick, OPWDD, as well under Department of Health, under Donna Frescatori's leadership, changed OASIS, OMH, and OPWDD's regulations so that we could do virtual visits. No, it didn't work for everyone. I think Jim was the one who pointed that out very, very well. But it did work for some. And it did allow quickly, within 2 weeks of a shutdown, allowed us to bill virtually for ComHab. That was something that we never ever would thought was ever going to happen. And hopefully it doesn't go away, because it's allowed my son to continue on with life as much as he can. That is, a guitar lesson once a week. Just talking to people and being connected. Because one thing we have learned in medicine and healthcare, as we join our healthcare and our social care together to become integrated delivery systems, which is what Dr. Kasner, our commissioner in OPWDD, is striving for. It proves it's successful. One thing we have found, one social determinant of health, number one is housing, very, very important to maintain, but it's also loneliness. Loneliness has been tied to smoking 15 cigarettes a day for your entire life.
That's what it does to your health. I don't know about you, but when I read that study, and it was done by Johns Hopkins, that just has always resonated in me. My son has always said, don't put me in a trailer out in the middle of central New York, because somebody will forget about me. It took him a year to articulate that when we would take car rides, but over a period of time, I pieced together, oh, Jack, you don't want anybody to forget you. So let's also talk about one other area that I don't know if anybody touched on, and that was that stimulus payment. $500 to me really isn't that much money right now, thankfully. Maybe next week it will be. However, when we talk about that stimulus, for those who have part-time jobs, but do not claim their own taxes, and is a dependent of ours for last year, he didn't receive a stimulus payment. We didn't receive the $500. Again, I can do without the $500. He cannot do without $1,200 that everyone else seemed to receive and enjoy. He has a home that he has to maintain as well. And just like everyone else that used it to fix up their home, some of them, in my area anyway, he could have used the money for that. I saw my son have abilities that 10 years of regression within a matter of 3 months. Anxiety that at a baseline is debilitating is now he's in a medicated state. My son has worked 2 hours a day, every day of the week for the past 6 years at our local BOCES. They've been a godsend for us, but he couldn't even do that. So what little bit that he does do contribute to society, he does contribute. I have over at any one time, like I said, 400 individuals that I have served personally, written their plans, helped them to make sure that they have a plan A, B, C, and D in place. And ironically, one of the ladies who here at the trial is her son was one of my clients. So it's a small world up here in upstate New York, up in central New York. But I do just want to emphasize that all of this for us in our family wouldn't have occurred without an SDS plan. All of the plans that families are coming up with, what do we do about remote learning? How do we connect? What are we going to do next? The answer for me has always been self-direction. We have to maintain that. We can't absorb that 20% withhold of funds. I'm not quite sure what that means from the Office of Budget, but that is unacceptable. And it's definitely unacceptable for an agency where there could be salaries up to $500,000 a year being sent a letter this morning told that it may reduce my son's housing subsidy. I don't think we need to do that. And I think some people are in the wrong business. Anyway, I kind of digress on that, but I really want to just echo everything that everyone's saying. Jim's testimony about the 20%, definitely Harvey's passion. It's really welcome and really appreciated that we have all of you. Again, thank you. I thought, like I said, we thought we were going to be speaking on different things until COVID came along and then quickly pivoted, and then the testimony was today as I sit in the doctor's office. But if you have any questions or comments, I'd be happy to ask.
Thank you, Sally. Really appreciate that. And we're gonna move to Mary Grace Giuliano.
I'd like to start by saying thank you, senators, for taking the time out of your very hectic schedules to listen to all of the parents, the agencies, really speak about the experience that we've had as providers and also the current system challenges. I too was going to speak on a global level, but we've heard speakers talk in that manner. So I'm going to go, as Jean did, to a more micro level about the agency. We service 294 individuals. We support them residentially, and we support 458 individuals within our day hab programs. Within our residential programs, we had 58 staff who tested positive. Unfortunately, 2 of them have passed away from COVID. We had 88 individuals who became asymptomatic. However, 47 tested as positive, and we'd had 6 individuals pass away. The service system was teetering before COVID came, and it continues to teeter. We have very dedicated professionals. Our direct support professionals and our direct management, they became hospice workers. They actually performed mortuary services in the city. It was a devastating event where we had individuals who passed within our homes, and we could not have them extricated from the homes. So we learned how to turn up the temperatures, how to wrap bodies so that we can preserve them in a dignified manner until we could access support services. As many have heard, we as a DD provider agency, we're not on the list of a critical agency. I continue to get information that we are not a nursing home. And even though there was advocacy that, well, we actually are quite very similar to a nursing home. We have 127 families that we support. Those 127 families, 111 of them are in the inner city neighborhoods, lower socioeconomic. They are people of brown and black skin and of Spanish-speaking origin. We've had a tremendous difficulty in accessing and supporting. We're able to push in and drop food. We're able to make sure that there's psychiatric care. However, for meaningful activities, it's been very challenging because there's a lack of access to technology. And even if that technology is available, there's the lack of ability to navigate the technology successfully. So we have been struggling to support those individuals. We likewise did not have a rapid response from OPWDD, so we secured our own isolation zones. We were operating in the manner that it was our responsibility to ensure the health and safety of the individuals first, and we would do what we needed to do that. I think the establishment of the isolation zones helped us, and from what I'm hearing, other providers across the state to actually keep the numbers in a decreased capacity so that we did not have an infectious spread throughout all of our homes. At this point, we are looking to reopen our day hub services because we want to support the individuals that we regularly support. And we are currently absorbing a $1 million loss monthly from the inability to provide those services. However, when speaking to families and other care providers, we too are looking at only having about a 56% return rate to program. So obviously we're looking at a 44% decrease in our service capacity. We too have looked to downsizing programs. When we are not billing for our individuals, what's happening is we do not obtain the property costs. So every site-based program, which we have 4, have property costs. So we are looking to divest of a program location, which means that we may have decreased capacity to provide services to individuals. We are also looking at the potential impact of the proposed cuts for October and looking at our vacancies. Unfortunately, when we have 6 individuals who have passed away, our vacancy rate is much higher than what we can sustain. So we're looking at combining facilities and creating homes for individuals, which will result in a decreased capacity of bed across New York State. So it's the cuts that are being sustained, they're not sustainable. People are not going to be served. We're going to have direct support professionals and other professionals that are not going, are being furloughed and will not have jobs. That's going to have a substantial impact across the whole economy of New York State. And most importantly, a 40% reduction in serving individuals is unfathomable. They are going to see wait lists. We are going to see probably increased hospitalizations. We are, as one individual speaker stated, probably moving back into a more draconian institutional way of serving individuals, which is absolutely not acceptable and should not be tolerated by providers, family members, advocates. So thank you for hearing from us. It's very much appreciated.
Thank you. Thank you, Sally. We really appreciate your sharing that with us. Next, we're going to hear from Marjorie Watson-Lay, the controller, for another step.
But there we go. We never have a meeting at work without me being on mute. So hello, everybody. I want to thank all of the senators for inviting us to attend and for being here yourselves. Another step is committed to safely supporting our program participants and staff during the COVID-19 pandemic. Our basic principle is to preserve choice for the individuals on how and where they spend their day. This has, of course, been quite challenging in these circumstances. The effects, I'll just summarize because everybody else has been quite eloquent and pretty much covered everything we had prepared. The effects of the COVID-19 pandemic on another step include moving out of our office and into our homes, limited to no access of PPE at the beginning of the outbreak. We were deemed not eligible by our county distribution. COVID-19 related expenditures, increased IT purchases, cell phone costs, PPE costs, cleaning and safety supplies, in addition to the increased hazard pay costs. And we hope that this will be reflected in future rate rationalizations. Guidance was issued slowly and changed often on service provision, billing rules, and safety. We had virtually no time to adjust to the loss of the retention day funding, billing rules that pit agencies against each other for retainer day funding, and devastating cuts to local assistance programs such as ISS, which fund the individual's ability to live in their community. And then we have cuts to the group homes, which makes it unable for them to live in the group homes. So where is our population of the intellectually and developmentally disabled adults? Where are they going to live? So throughout all of this, our DSPs kept working with individuals both in their homes and in our group homes. We worked to keep our vulnerable group home residents safe while being, having our DSP staff work in multiple locations. We kept adapting to opportunities and limitations on service provision, and we need the K-waiver and telehealth options to continue. We are trying to get back to normal and communicate this to families by anticipating and agreeing with families what reopening a without walls, life plan agreed service provision will look like, and persuading them to follow safety protocols around home visits and out in the community. As always, we feel it is up to us as a collective group to hold all of the service providers that work with our loved ones to a basic principle, the right to choose how and where they spend their day as we partner with them to create lives of choice. In my remaining time, I want to focus on the devastating cuts to ISS. ISS is an essential program to so many individuals who are capable and wish to live independently in the community. It is the true meaning of person-centered support and community integration. It provides those individuals who are capable to live independently, giving them the opportunity to find and lease market rate apartments in their communities, just like you and I can. However, due to limited income, most individuals rely solely on SSI and SNAP food stamps. These individuals cannot afford market rate apartments without the assistance of the ISS subsidy. The program ISS subsidy. The program is designed to meet the extremely high rent levels in the Hudson Valley region. And it's also designed to allow a 15% factor to cover agency administrative costs. The 20% cut announced last week as effective immediately means that agencies now have to fund the administration process entirely and absorb a 5% cut. And these individuals have legal lease agreements with their landlords. So how are they going to meet these lease agreements? Is going to result in homelessness. The cutting of the funding at OPWDD is expecting providers to pick up the difference. And in this environment, that is just not a viable option. The cuts to the program is a direct impact on individuals who rely on this funding, not so much to us providers. I mean, it is a hit to us, but it's the lives and the quality and the lives of the individuals with developmental disabilities. Where are they going to live when they get evicted? And what about the individuals who are just starting out with trying to look for an apartment on their own and would rely on ISS funding? No agency will be able to take on any new individuals with these devastating cuts. And that, I think, is my 3 minutes.
Marjorie, thank you very much. I really appreciate that. I want to thank each of the panelists for sharing these concerns with us. It's so important that we voice this and really have a record of it, because that's what we want to do, is take the information that's shared with us today and present that to the entire legislature and to the executive as well, to make sure that they understand what's at stake. And I think we've seen the same thing said in different ways and covering a few different issues, but the same thing, that we need the funding to continue, that these cuts will be so extremely harmful. I wanted to ask any of the senators that are on if they had any questions for our panelists. If not, what we'll do is we're going to move on to our fourth panel. We have with us today, we have James Moran, who is the CEO of Care Design New York. We have Louis Grossman, who's the CEO of Advanced Care Alliance. And we have Yoel Bernarth, who is the CEO of Tri-County Care. James, if you could start us off, that would be great.
Yes. Very good. Thank you, Senator, and thank you to all the senators for holding this panel discussion today. Very important topics to discuss. I'd like to first start by thanking our direct support professionals, particularly in the 10 counties where most of this impact was born, but across all of the state, they really are our heroes. And a real shout out to families who have had to endure the stress and anxiety of particularly those, the 70-some thousand of you who have your loved ones at home. The stress and turmoil you've had to endure for over 5 months is just unbelievable. So I just want to start by thanking all of you, each of you. And my heart goes out to all of you in terms of what you're facing as a family. First of all, Care Design, just wanted to give a very brief on Care Design. We're one of 7 care coordination organizations in the state. We support about 27,000 people across 30 counties. 2/3 of the population that we support we're in the 10 county hotspots where the virus was rampant particularly for 2 to 3 months. We have held weekly calls with our families to keep them apprised, give them opportunities to ask questions, to vent, to have a place to speak and feel heard. And it's been, you can tell that the stress and anxiety on the part of families trying to get through this. And we've been doing that since the pandemic started, and we continue to do these. I think what we have learned is that, the feeling of isolation over time has increased, the anxiety, anxiousness, and families are looking for answers, quite honestly, and answers have been hard to come by. Just from an observation perspective, I consider, as having been in the field many years, I think the IDD population has become the forgotten population. The statistics bear this out relative to the infection rate once it hit our community. We have an infection rate that's about a little less than 4% in those 10 counties, significantly higher than the general population. We had hospitalization rates for those impacted people of about 56%. of those individuals who had the virus ended up hospitalized. We had an overall death rate of about 16%, which quite honestly, in many respects, was taken for granted. Very sadly, I might say. 84% of the people were over the age of 50, and more than 80% of the individuals lived in group homes. So, and I know some of our providers have spoken about this previously in terms of the spread of the virus in group homes. And it is a challenge to keep people isolated. What I have seen is a complete lack of empathy for the field, and both from a family perspective as well as the people we're so blessed to be able to support. In terms of other observations, what we have seen is really a lack of collaboration. And it's been more of one of reactionary versus proactive approach to things. A lot of deferral was taken by OPWDD to the health department, really not looking at us as a unique population that has different needs. We had a fight to be able to get access to individuals who were hospitalized at 55%. For months, we could not get either staff or a family member in to visit their loved ones. Many of those individuals could not speak for themselves and had nobody there to help them. It took us months to get that in place. That should never happen again. Everything that we've been able to accomplish advocating took weeks or months to get into place. That should never happen. A lot of non-responsiveness, lack of clarity, as people have talked about. We still have many things without answers. And so quite honestly, it's not been a good experience. One would think that a crisis such as this, never seen in our lifetime, that this would draw people together to solve problems together. And that is not what's happened. As you've heard from some of the speakers, the advocates, the providers, the CCOs, are not seen as collaborators. They're seen as somebody that we have to divide and conquer. And that's no way to treat individuals with intellectual and developmental disabilities. This should be a coming together moment of the entire field and the state to really work through the challenges as best we can. One thing I would suggest, and I'll end on this, is that one thing that's not done, but the field will do this on their own, is there's been no coming together to talk about lessons learned of what happened, particularly during the months of March and April, when the virus was really at its peak. There's not been a coming together to learn from the crisis, because there will be a round two. There will be a round two. And quite honestly, agencies and families are left to their own devices to plan. There is not a plan in place right now with government in terms of coming together to work on what did we learn from the first go around so we don't repeat the mistakes, and how do we really set the system up so that we can be more responsive the next time around. We owe that to the individuals that we are so lucky to support and their families. So thank you.
Thank you, Jim. Really appreciate that. And you're exactly right. That's why we're here today. And we have to keep in contact and continue to work together post this forum to make sure that the lessons that are learned are implemented, and we make sure that we are in a better position if there's a round two and other types of crises that happen. So thank you. Next, we're going to hear from Yoel Berth from Tri-County Care.
Sure. Thank you, Senator. Hopefully you hear me.
Yes, we do. Thank you, Yoel.
Great to see you. I'm in your home district, so it's always a pleasure to see you, and thanks for your friendship. I want to thank all the senators that participate in today's session, which is really important. I want to second my colleague, Jim, in a shout out to the families and individuals and advocates who have been, outstanding is probably an understatement of what you have done over the last few months, what you always do for the individuals we all dearly love, but we truly, truly outstanding. I also want to give a shout out to all the direct care staff as well as to tell you briefly about Tri-County Care. We are one of the 7 care coordination organizations in the state. We service 25 counties. We have 600 staff, about 525 are care managers, and the rest are administrative staff. And we serve about 12,500 individuals with developmental disabilities. When COVID broke, we and most of the other CCOs, especially the ones who operate in the downstate region, we immediately moved to work our workforce to move them to work from home. I have to say that they did, our staff did an outstanding job in transitioning 16 ground offices into everyone moved into their own home office, or some of them working out of their dining rooms, bedrooms, or attics. And they immediately jumped into action to support individuals we serve. Out of the 12,500 lives we serve, about 85% of them reside in the community. Only about 15% reside in residential settings. So by virtue of living in the community, they were vulnerable to, some of them at risk for shelter, some of them at risk for food, some of them at risk with PPE and so many other items. And the care managers worked round the clock to support them. They have conducted these monitoring and support tools that we quickly implemented, and they were on the phone with them, virtually phone, any way they could to be there as their lifeline and support. I would also share that the 7 CCOs, we were working collaboratively to support the population in the entire state. We met every morning at 7:45. The 7 CEOs of the CCOs and our senior staff met, and we jumped in immediately to collect data, share experiences. And one of the things that we were troubled early on was the restriction of family members to join. If a member of our DD community had to go to the hospital and they wouldn't have a companion with them, and we all understand that where people are nonverbal, they can't communicate, it's impossible for them to be there. And it took some extra weeks, after that memo was issued by the Department of Health, to make an amendment to allow for companionship for DD population. But that was really, a very, very difficult one to deal with, as family members were calling right and left and asking for support. We at the same time, as we moved along during the pandemic, we were also hit with a real budget cut. And as we work together with our state partners, our ask has been, give us more regulatory relief as we're moving along. And one of the areas in regulatory relief is give us more flexibility to how to conduct and when to conduct face-to-face visits, or even virtual visits. The requirements to go from monthly to less frequently, or as frequently as needed, in a person-centered way, driven by what the individual really wants. Also, one of the things that we have seen a lot is we have as I mentioned earlier, we have 16 ground offices. We have offices in Queens, in the Bronx, Manhattan, Brooklyn, in Albany, Capital District, Staten Island, Long Island. And one of the purposes of having so many field offices is that individuals who are new to services should be able to come in and access the OPWDD system. What we've experienced over the last few months is that there is really a delay in getting new people enrolled in services. Front door sessions are not the way they used to be. And we've tried, we are working collaboratively with the regional DDROs, but it's still a challenge. I had a management meeting yesterday with my staff, and they've expressed a lot of concern on the fact that there is a delay in getting services. Just one final tidbit, we conduct phone calls to newly enrolled individuals, kind of to survey them how the experience is going. Out of the 14 calls we conducted last week, a majority of them were complaining about the delay in getting new services. And that is something that I feel is important to share with you from the legislative side, because something has to be done about it. I want to wrap it up with, again, thanking all of you, giving us the opportunity to present. Hopefully we can move to an environment where we can continue to serve and deliver to the people in a person-centered way. And on behalf of all the care managers, Tri-County employees, our ask is let us focus more on delivering services and a little less on paperwork and regulations. Thank you very much.
Thank you so much. Really appreciate that. And I just wanted to check, I'm not sure if Louis Grossman is with us. I don't think so. So I just wanted to ask our panel, our last panel, just a couple of questions. We just recently spoke, Yoel, you spoke about the delay in services. And can you just speak in terms of because this is an ongoing issue that we've always faced about access to services in a timely manner. Could you just tell us a little bit about the discrepancy in terms of what type of delay you're seeing?
So there is, sure, Senator. So there is a number of items, that has to happen with an individual. So even though we can assume that they have a developmental disability, they have to go through a number of eligibility checks. They need an evaluation by a psychologist. They need a physical, and then all of the documentation need to be pulled together in a packet, submitted to the local DDRO. They have to go through the front door session. And there's a number of steps in that. So first of all, access to care, simply to get a physical done is a challenge in this day and age. Having a psychologist evaluate you has always been a challenge, but simply because there's not enough and there's always a waiting list. And then, but even after that, when everything is done, since majority of the state employees work from home, and the technical challenges that exist today because of COVID is just, it's creating a natural delay in getting services. And then even though when someone is already enrolled and they pass the initial eligibility to be enrolled in the CCO, they get assigned a care manager. Then the care manager has a conversation with them and creates what we call a life plan, right? To walk through what are the different needs. Well, you need respite services, day program services. Then to get all of that, and then they need to complete all of the paperwork and get it back to the DDROs to process that approval for the actual services. That takes a very, very long time. And it's never been a speedy process, but right now, depending on which region, it's taking a lot longer. And so families get disappointed while they have already a care manager. They call the care manager on an ongoing basis, and instead of bonding together and figuring out what the services are and getting them the services, it's taking a long time.
Thank you. Thank you. And Jim, to follow up on that, because we're talking about some of the delays that you've seen. I mean, one of the things that we were seeing firsthand was the issue of the visitation. And that's something, the patient advocacy that I think we all kind of saw, and how it just speaks to the issue of, hey, we know we're in unprecedented times and there are some things that take a back seat. Now we're learning and we're saying, hey, we can't allow this to take a back seat again. That's just an example of something that we all saw. Are there some other specific issues, that you could highlight? We don't have to get into the weeds, but of areas of concern.
Yeah, no, absolutely. And thank you, Senator, for following up on this. Yes, and I think some of it you heard earlier with some of the testimony. We had collaborated with the service providers on developing what I would say was an isolation plan for when people who were tested positive to, as Susan said earlier, the ability, a lot of our homes range from 4-person, say, to, into the teens in terms of the size of the homes. The ability to isolate in this population, really to be able to withstand and support isolation is very, very challenging. So it puts the agencies in a very tough spot. So they had to do things on their own, as you heard, but we had worked with them on a plan that went nowhere with the state in terms of trying to provide opportunity to create isolation capacity in the provider community. That was a major thing that went by the boards, and the agencies were left to figure this out for themselves. Was one of the major issues. And quite honestly, nobody wants to put people into isolation, but you have to either remove the people who have the virus or get the people out who don't. And that's thing. The other thing that, there is not a plan to go forward. Susan brought up testing. I know there's not consensus around testing. but there really needs to be a thought out process here on how testing should be part of a protocol process. You know, there's challenges with visitation to the homes. That took a significant amount of effort to where loved ones be able to, many providers weren't equipped with telecommunication relative to video connectivity. A number of providers, aren't equipped for that, particularly state homes. Were not equipped to be able to, so that family loved ones could see their loved ones in the group home, for example. Inconsistency on the policies around that was going on. I mean, those are some of the key things. A number of our family our families we support took their loved ones home. Care Design had about 400 people at one point in time who had taken their loved ones home. We still have over 200 that still have kept their loved ones, trying to support that. Now that's going to be challenged come 10/1 when providers are going to get whacked financially. If families are very nervous about going back to some form of normal. So I think that's also something that you should be, I would recommend that you look at in terms of checking the pulse on families about even just returning to the group home settings, in addition to obviously people not willing to go back to day programs at this time.
Well, thank you very much. And we heard it over and over again about the delay in services and some of the new changes. And I think as we review some of the remarks made today, and we continue on and work through the weeds of some of these issues, that we see some of the opportunities that maybe we can use the telemedicine in a way that will make it easier to access services. But we've got to put these systems in place and make them uniform throughout the system and understood from the top levels all the way through. And I think that's a big part of what we're hearing today, is that clarity and also that uncertainty. And we're in an uncertain environment, and we know and we understand that. But what can we be doing in leadership from the state level to minimize that uncertainty to the best extent possible? And to many cases, it seems like the state has only exacerbated that uncertainty, and that's something that we need to work together to fix.
And Senator, can I just add one thing, Senator? Just so I think you raise a good point. I think you heard from the families and the folks who have been doing self-direction. Really, while the service providers have also been left, sort of to fend for themselves, you cannot do that. And not that that should happen for providers, but it really cannot happen for families, where they're left to, to figure this out for themselves. It's not right. It's not fair to them. They already have a heavy burden of support that they have to do. And quite honestly, we continue to leave them in the lurch. In this latest round of withhold, treated equally, everything got withheld 20%, even though, as you heard from some of the testimony, this could put people being forced out of their apartments. That's really, in all honesty, very shameful that we've come to this, because this withhold could turn into a cut, in no time. So we're very concerned about those families. Just so, again, to highlight what you've heard from those families, it's a very, very significant challenge. And there doesn't seem to be any analysis that goes into, does this make sense to just, do everything across the board, which is what's happened here.
Yeah.
There's no assessment of what the results are going to be in doing that. So thank you.
Thank you, Jim. Really appreciate that. And that about wraps up all of our panelists today. And I just want to particularly thank everyone that joined us today, but I want to especially thank Senator Mayer for starting the meeting off. I called her early this morning and said, I don't think I'll be there on time in front of the computer. So thank you for picking up in a moment's notice, but obviously having a deep passion for the issue at stake. And to all the senators, Senator Prasad, Senator Liu, Senator Martinez, and Senator Parker and Kaminsky and Senator Felder, Thank you for joining us today and for being here. And we're going to be working together. My team is going to issue a report and recommendations, working with the senators, and we'll be reaching out to the panelists today and others to get more into the weeds and some of the details to follow up on some questions. This will be online and accessible. We recorded it today, and to use as a pathway forward. This is really a starting point for us in the legislature to say, okay, where can we review and learn from this difficult time? And where can we find opportunities to improve the quality of life of our most vulnerable residents? And we have to push back on the issues that we're talking about today. We have to make it easier for providers. We have to make sure that there's a pathway for our direct service workers to have a livable career, really a career. That's what we want, that we have that longevity and that we have people that don't have to work multiple jobs and can take care of what's most important. With that, I wanted to ask any of the senators if they wanted to say anything, any closing remarks. Senator Mayer?
Well, one, thank you, Senator Carlucci, for convening this, and thank you for the excellent group of panelists representing the geographic diversity of this issue, as well as the various interests. And in particular, thank you to Assemblyman Harvey Weisenberg for being a passionate voice of conscience. And I know I sat with him in the Assembly, and I think Senator Kaminsky, well, that was before when we were there together, and he really single-handedly has changed the trajectory in New York pre-COVID on this issue. So we're eternally grateful for his leadership. But I want to thank the parents and the providers, and in particular, soft spot in my heart for the parents who I personally believe have not been heard enough by this leadership of this agency and by the second floor. And I hope they're paying attention to the passion and the reasonableness, but the care of these families about their loved ones. Couple that with the folks like Senator Prasad who have family members who work there, and all the people I know who work in these settings who are really have taken a real hit in this COVID. And I don't think they've gotten the attention or the accolades they deserve during this period, either financially, emotionally, or in any other way. So I think you have a bunch of senators who feel as passionately as you do, Senator Carlucci. And we look forward to pressing hard as we go forward. Thank you again.
Thank you, Senator Mayer. Thank you so much.
Senator Carlucci.
Senator Prasad, please.
Thank you. Thank you, Senator Carlucci, for hosting. And Senator Mayer, great job. Pinch hitting, great job. So thank you to all my colleagues. Thank you to everyone who participated today. We understand your passion. I commend you for everything that you're doing. I thank you for everything that you're doing. You know, personally in my district, I have a number of residences, and I've been working with them. I've even made sure to acknowledge them by giving them a New York State certificate and a letter, personally signing a letter, thanking them for all that they have done, because they are the unsung heroes in this entire pandemic. I think we need to hear more, though, from workers within the industry. We have not heard their voices. We tend to say we know what is going on, but we need to hear from the workers, just like we need to hear more from more parents. We need to hear from the workers. So continue to give us information, continue your advocacy. Thank you, thank you, thank you to everyone for all that you're doing. Thank you.
Thank you, Senator Prasad. And want to thank everyone again for your time today and for your input. We look forward to following up with you and issuing our recommendations and taking action and making sure that we're continuing to improve the quality of life of our most vulnerable residents, their families, and the people that care for them. So thank you so much for being here today. With that, our meeting is adjourned. Thank you.
Thank you.